everyone, welcome back to What's a Fertility. Today we have an exciting guest on with us. Her name is Katrina from Fertility Point Acupuncture and Chinese Herbal Medicine. She works with many patients that have recurrent miscarriage, implantation failure, unexplained infertility, endometriosis, PCOS, and the list goes on. We are so excited that you're here and just to hear all about your practice and acupuncture. I know me and Kat both did acupuncture as we were going through IVF, and so we are big proponents of it. So we would love to hear just where you're from and how you even got started into this.
Yeah, so thank you for having me on your podcast. It's a really great honor to join the ranks of so many other great guests that you've had on before. So my name's Katrina. I am a registered acupuncturist and Chinese medicine herbalist. And I've kind of slowly gone through the path of then having a special interest in fertility support and women's health. So I started in September 2020 and then slowly just doing sort of general practice in terms of acupuncture and then slowly made my way towards women's health. So I did start to have an interest when we started learning the gynecology subject in year 4 of our studies. And then over time I kind of just, I guess honestly, when I did start studying acupuncture, I actually didn't want to do fertility. And then over time I kind of realized that I think, there's been, women's body's been hijacked and there's just so much more that we can do for women's health. And over time that's kind of changed my mind and I went into that area.
No, I love that. That's incredible. And where are you located?
I'm in Safety Bay in Western Australia. So
Okay, that is so cool.
here just about a year ago. Previously we were in Sydney.
Okay.
And did a 6-month camping trip all across Australia and then ended up
Oh,
here.
so fun. I know. I have a cousin that lives in Australia, but she actually just recently moved and she's now in Perth, which is like
Okay.
the farthest I feel like from us ever. So it's so funny. But she was in Brisbane before. So yeah, very
It's
different,
amazing
but
here on
that's
the West Coast.
awesome.
It's very
Yeah.
different. So peaceful.
Yeah. I know I've never visited, but I've always wanted to. And now I have someone that lives there, so I'm like, I have an excuse to go. So I just need to do it. It's just it takes forever to get there. So that's the hard part.
Yeah, definitely the beaches on the West Coast are definitely better
Yeah.
than the East Coast. Yeah.
Yeah, for sure. But no, this is incredible. And I love how I feel like this happens often is like once you get into women's health, you obviously find a specialty, but so much like of the fertility world, I feel like now is becoming like a bigger thing and it's more talked about. And so I love that you've specialized more into that part too. And so, yeah, I'm so excited just to hear about what services you offer. I was on your website, which is so cool. You have amazing things that you offer. And so herbs, I saw acupuncture, you do, which I've seen all over TikTok. I don't know if this is, but the ear seeds, I've seen so many cool things about that. But just even the gua sha, I mean, you have so many services. So if you want to kind of go through what you offer and what that looks like.
Okay, so in terms of fertility support for acupuncture, generally I do like to tell patients to come in at least 3 months before they start, whether it's an IVF cycle or trying to conceive naturally. But I understand timelines for everyone is different, but generally I do say working with patients for at least 3 months because we want to get the hormonal system in balance and it takes time for the body to then adjust, to rebalance. It's not just, one quick fix and then here we go. But I see patients coming in all sorts of timelines, whether it is preconception or before an IVF cycle, or even they're just about to start an IVF cycle, or they've even already started and they're about to have transfer or something like that. So it really just depends where they are in their timeline, whether we have a bit more time to work on any constitutional issues, so any imbalances in the body that we would recognize from a Chinese medicine perspective. We ask so many questions. We've got an intake form which I email out to my patients before they come in, so then it gives us more time to focus on what's important. But yeah, I tell them it can take up to 10 to 15 minutes to fill in because it's quite comprehensive, and yeah, just go a deep dive into what's happening in their body so we can really understand, because as we say the word infertility, but what does that even really mean? It's just such a
Yeah.
blank term. It just doesn't give any answers, and I think it's a bit of an unhelpful term for
Yeah.
patients, but hopefully from a Chinese medicine perspective, we can give them a bit more of an idea of what's happening in their body from the way that we diagnose based upon the pattern. So we've got specific groups of symptoms together. So even though if one person has been diagnosed with endometriosis or PMOS now, as it's called, we wouldn't treat each of those patients the same way. So one patient's what we see as the root cause of their endometriosis could be different to the next patient. So we then treat according to that.
Yeah, no, I love that because I often feel like physicians often, and I'm not trying to put them as a whole, but they look at endometriosis as like one diagnosis and they treat it all the same. Like they are not going in as to see each individual case necessarily for like endo or what any kind of specific diagnosis. I feel like it's just like, okay, you got that label and then they give you the meds or they give you this, they say do the surgery or whatever it may be, and you're not really looking deeper into what the root can be. So I love that you make it like individualized for each person.
Yeah. So I can't say that we specifically treat endometriosis or we're curing or anything like that, but we're definitely helping with the symptoms. And ideally, we are trying to help with the address the root cause of it as well. So hopefully stop any symptoms from getting worse, any more proliferation of tissues or anything like that. So try to help in those respects as well. And then in terms of IVF, so again, depending where they are in the cycle, whether we have a bit more time to work on their constitutional issues, or if they've already started a cycle, then we'll focus more on those specific IVF cycle timeline in terms of increasing more blood flow to the reproductive system, so to help with getting the endometrial lining. There's a lot of patients that come in that have thin lining, so we want to help boost that. So they have, the embryo has a nice juicy lining to implant into, and then then you get nourished and build up all the vascularity and everything that they need to be supported. And then other things are, I'm just losing my train of thought a bit, but anyway.
No, you're fine. Do you recommend any herbs specifically for when you're going through fertility? Is that something you do, or was that something more for different women's health, not necessarily fertility, would you say?
Fertility, yes. So if they're trying to conceive naturally, definitely do recommend combining herbs and acupuncture together. I do, if the patient is doing IVF, if they're before starting the cycle, before starting injections or anything like that, I do recommend herbs. But once they're in the cycle, stop any herbs just because I don't want it interacting. That's how I've been trained. Don't want it interacting with any of the hormones and everything they're taking, and don't want any of the readings for their physicians to go off as well. I can't say anything specific because everybody's different. There are general formulas that we do focus more on, like previously before, blood nourishing, blood circulation, fluid metabolism. So there's a lot of patients that I see what we call in Chinese medicine dampness, so an accumulation of fluids, and with the reproductive system, we want those follicles to be nourished. We don't want fluids to be sitting somewhere where they're not stuck, and we want them flowing nicely through the reproductive system. So I do recommend herbs, but I can't specify anything specific without specification because every formula is different, and we also make modifications to formulas depending on how the patient's presenting as well.
That's awesome. And I did see on your website that you do go over like digestive problems. Have you seen any kind of like link with fertility and digestive issues as well? Or is it really kind of just different? Or do you treat them kind of together?
If it comes within, it does play a role in terms of the pattern diagnosis as well. So I do see a lot of patients with also, issues with fertility and also digestive issues at the same time.
That's so interesting.
Again, that can also lead to dampness, weakness within the digestive system, which then can lead on to, poor blood formation, and things like that. So digestive issues do play.
No,
a
that
role.
makes so much sense.
And also,
And I know when I went through my acupuncture, they gave me like a list of like foods that they like highly recommended while I was going through IVF, like very nourishing foods, warm foods,
Yes.
especially after the transfer and stuff like that. Do you guys do something like that as well?
Yeah, I do that as well. And there's the other side of it as well. So depending on each person's body, we look at what we say yin and yang, so the opposites. So either you're in a deficient state or you're in an excess state. So sounding like, you need more nourishment, being possibly in a deficient state. But again, on the other side, there would then be other food suggestions for someone that's in an excess state. So say someone with what we would call blood stasis. So whether or not it's that can kind of link to endometriosis. So build up of blood. If you imagine the endometrial tissue like building up in places where it's not going to be, where it's not meant to be. Someone with a lot of large blood clots when they have their period. So you wouldn't want to give them those nourishing things. So they would have other food suggestions for them.
No, it's incredible. I love that. And that will be something also you will be able to find out through that first like questionnaire that you send
Yes.
out where they answer all those questions.
Yes, and then also seeing them once they come in as well. Just seeing them, just like their physical appearance as well. So we very much have to use all our five senses when we do diagnosis as well, and just seeing the person, their demeanor, everything. What we call the shen, so like the spirit in their eyes as well, and then also checking their body in terms of palpation, feeling the pulse, checking the tongue. Also, we'll palpate specific parts on their abdomen and also their legs as well to check about some other things to help with the diagnosis and see what's happening with their body in that respect.
That's incredible. That's really cool. I did see on your website also you work with women that are going through like perimenopause and menopause. I'm like so curious about this because they diagnosed me with like I'm at the end of perimenopause, they said. So I'm currently on like hormones and stuff like that to help with that. But I'm just curious because I know there's a wide range of our listeners. So some are still in that fertility world, but then there's also some that like have had kids now or possibly going through menopause. So, I mean, we'd love to hear just kind of what you guys do with that as well.
Yeah, so again, individualized treatment. I'm possibly starting to focus a bit more now on that because I think that's going to be the next phase of my life soon as well.
Yeah.
But very much supporting women through that big hormonal shift. So it's a lot of symptom management, the typical
Hmm.
things like the night sweating, hot flushes, helping maintain or reduce those as well.
Yep.
Just making a smooth transition. So it just sounds quite uncomfortable from
Yeah.
what I've learnt about it and everything. And hopefully be able to herb myself up and acupuncture myself up so it'll be a smooth transition for me as well. But
Yeah.
herbs, acupuncture, and just making them like symptom management is the main thing, and just making them
No, that's
feel.
incredible. I honestly didn't even think, I think I've always just like linked acupuncture in my world, like in my brain as like with fertility. And so
Yeah.
I didn't even think of that as an option that
Yeah.
could like help and like the herbs and everything that could help like perimenopause and menopause. So that's
Yeah.
awesome to know.
And I think also a big thing is the emotional and the mental part of that shift as well for women. So it
Hmm.
can be a stressful time as well. So helping them relax, manage the stress in that way as well as it is.
Absolutely.
Such
No,
a huge thing.
absolutely. How can people find you? Like where, so I know you're located in Australia. Do you do any virtual or is it only in office?
I do, to acupuncture is just here. I do telehealth herbs as well. So patients around Australia can contact me that way. I'm just not sure if I don't know if I can send herbs overseas. But telehealth around Australia, that's a
That's
possibility.
awesome.
So I do still have some patients in Sydney who I do telehealth consults with and send herbs over to them.
No, that's incredible. No, I love that so much. And we have had a lot of listeners in Australia, so
Yeah.
we will definitely make sure. How can they reach out to you? Where can they find you? What's like the best way to book
So
with you?
on Instagram, I can't remember what my handle is, but I'm sure we'll post it up there. But Instagram, and then also Facebook as well. I'm all on there, so I'll send you the links, but I just can't remember my handle. I think it's
Yeah,
fertility.
I can. I will put everything on the show notes and your website. Your website is incredible, and it has
Thanks so much,
all these
friend.
different resources on it too, and just like Q&As and A's and everything. It's really, really good. Would you use cup? I saw cupping was on your. I've never personally tried it. I've seen it before, but I've never. Would cupping be anything like helpful for fertility? Fertility at all? Or is that entirely different?
It can be helpful for fertility. So there is a particular technique. So in Chinese medicine, we want the womb to be warm. So, warmth is life, warmth is blood flow. So there's a particular technique that we do where we use a single cup. So we actually get a coin. So in Australia, the largest coin is 50 cents. So we wrap it up in a tissue and have a bit sticking up the top. And then essentially, put that over the belly button. So you can imagine belly buttons here, we have the coin and there's a piece of paper wrapped up around it and there's a bit twirled up sticking up the top. So we actually light that on fire and then put a cup over it immediately. And that's meant to draw out the coldness from the uterus, from the abdomen.
That is so cool.
Sometimes, you actually can
So
feel
would that be
that.
recommended before the transfer then?
Not right before. It would be in
Like the
months
earlier
before
stages?
earlier stage, yeah. So not right before transfer. We would then just focus on acupuncture. But if we're in that sort of 3 month phase prior to starting cycle, we can do that. And then obviously making sure that they're, say, just after their period, just to make sure that there's no possibility of being pregnant as well. Yeah,
That's
so
awesome.
it's really,
No,
and
that's
then
so cool. I've never seen it. At least here in the States, I haven't seen it. Like cupping be used for any like fertility treatments like that. That's really, really cool. I mean, it makes sense. That's awesome.
yeah, or even if we want to target specific points, also on the back as well, that might be part of our point protocol. We can do cupping on the back to help with the circulation there too.
I love that. Okay, so I know you mentioned you would like if somebody contacted you. So I just want to make sure people fully understand. So if they contacted you and they want to have an appointment, so
Yeah.
the first thing would be that you would send them like a questionnaire. They'd
Yes.
fill that out, and then they would meet with you in person, and then
Yeah.
you guys would kind of basically just make a plan from there.
Yeah. Yes. They come in, ask some more questions, and also just get, I guess, the story from them. 'Cause that's just a huge part in terms of people's fertility journey, just to understand where they're at, how they're feeling about it as well, because that's a really big part in terms of the mental, emotional landscape that they're dealing with. Yeah, and then we have a chat. Essentially, then I will then come up with my diagnosis, and then we make a plan. Ideally, so just like you take medicine and you have to take a specific dosage, acupuncture is like that as well in terms of what people have seen in research. So we just want to make sure that we have enough. So say if it was someone who came in closer or they had already had started their IVF cycle, I would be having more frequent treatments during that time just to make sure they get that appropriate dose in.
That makes sense. Once they get pregnant, do you recommend them staying and continuing acupuncture, or is it something that you shouldn't do while you're pregnant?
No, it's definitely supporting, definitely help to support the beginning stages of the pregnancy. So I do recommend patients stay on at least for the first trimester if they have the time and resources available. So the main thing is just to help, yeah, again, blood flow, stress management, just to help with the early pregnancy as well. And then just depending upon how their symptoms are coming into second trimester, I guess generally there is that sort of hopefully that decrease, but not for
Yeah.
all women, that decrease in morning sickness symptoms, fatigue and things like that. We then decrease it over time, but some patients, some symptoms do persist, so we do continue on a more frequent weekly basis, but it just depends on how they're feeling as well and any other symptoms that might come up during pregnancy. Acupuncture can be helpful for. And then towards about week 35, week 34, 35, that's when I suggest patients coming then come back in frequently again for birth preparation acupuncture.
That's
So
awesome.
help get the hormones going that you need, that hormone cascade for birth. It's even strengthening up their bodies as well for what's going to be the epic journey of birth as well. So get their energy levels up, get them in that mental space, get them relaxed. That's that big part to get the oxytocin flowing for
Yep.
birth as well. Yeah.
That's incredible. No, I love that. And I guess I didn't even, yeah, I didn't put that together that you probably should continue as you're pregnant and then especially at the end. That makes sense. And honestly, it's
And
like
postpartum
such a
too.
relaxing thing to lay there for like an hour or whatever it is, just to be able to just have a space just to like have quiet Zen time. I feel like is so helpful at the end.
Yeah, yeah. And then a big part is also postpartum support as well. So I guess there's always just the focus on the birth, but no one actually thinks then about what about
Yeah.
afterwards, particularly
Yeah.
women on under C-section as well. So wait a few weeks, but then we can also help with the scar healing.
Oh,
Um,
that's amazing to know. I had a C-section with my first. Yeah.
yeah, so helping
Wow.
break down that scar tissue just so it doesn't get so hard, and particularly yeah, if women, if families are planning on having more children as well, just to help soften everything up and make sure everything's nourished. And yeah, a big part of Chinese medicine is nourishing during postpartum because we lose
Mm.
so many resources during birth. So
That's
yeah.
incredible. Do you often see patients that are like in the postpartum area?
If they're available to come in. Previously, I was doing house calls, but I don't do that much anymore because I have a
Mhm.
3-year-old now.
Oh,
But yeah, sometimes they're able to come in, but I might start doing them soon
yeah.
since my daughter's in
That's an
daycare
awesome
Sunday. So
service. Yeah.
yeah, to
That's
do
really
that
cool.
again. Yeah.
Well, I love that. Is there anything else you want to share about your practice or anything with our listeners?
Um, let me think. Let me think. I guess yeah, I think it's something that's helpful in terms of patients that I've seen. I've
Hmm.
seen good results in terms of people that have been trying for a long time or patients that have had recurrent miscarriages. And then also just seeing, yeah, I guess people having undergone multiple IVF cycles. And I can't say it's just attributed just to the acupuncture, just to the herbs itself, because they
Hmm.
have undergone also changes to their IVF protocols. So we can't take full credit for that.
Of
I
course.
think it's definitely a
But I think it's great that it's like a different perspective. Like you're working on something entirely different than your traditional, either OBGYNs or fertility doctors. Like it's entirely different approach. And I think
yeah,
it could be work so well together.
yeah. And I guess the big thing about IVF actually doesn't it helps increase your chances of pregnancy, but it doesn't actually solve any infertility
Mhm.
issues technically.
Yep.
So I can't say that we're solving infertility, but we have we are supporting it from the
Yeah,
results that we've
absolutely.
seen, and yeah, it's just helpful. And then a big part the emotional side as well, because yeah, we need that body to be nice and relaxed, the mind to be relaxed, help manage that for patients too.
No, that's incredible. Thank you so much. We love what you're doing. We will be sure to share it. Again, this is Katrina from Fertility Point Acupuncture and Chinese Herbal Medicine in Australia. So definitely, if you are in Australia, check her out. We will have her Instagram linked in the show notes, her website, Facebook, all of that. So definitely check it out because not just only fertility, but all of women's health, she is there to support you. So definitely check her out.
Thank you.
Thank you so much.